Hi, good afternoon, everyone. I'm Mary Ann Joyce with OHC. I'm the OHC physician liaison. And today we have Dr. Anna Sobolewski, who is our breast surgical oncologist, and she'll be presenting information on cancer risk factors with dense breasts. And dense breast tissue. Dr. Sobolewski is board certified breast surgeon, and she specializes in hidden scar surgery, nipple sparing, mastectomy, oncoplastic surgical techniques, and the use of wireless localization technology. And when Dr. Sobolewski is not working, she's spending time with her family, friends, playing pickleball, or reading. So take it away, Dr. Sobolewski.
Thanks so much, and thanks for having me here today. Do we have the next slide? So we'll just start out with an overview of breast cancer, since we are in Breast Cancer Awareness Month in October. 1 in 8 women will develop breast cancer in their lifetime. That's 12% of women. So we all probably know someone who has breast cancer, or maybe in our family or friends, or maybe even personally. Next slide. 376,000 cases of breast cancer will be diagnosed this year. And that's 42,000 deaths that are going to occur from this. Next slide. The good news is the breast cancer death rate has declined by 44% from 1989 to 2022. And this is for 2 reasons. We have really good treatment options these days, and we're also detecting breast cancer a lot earlier. And that's because of the public awareness about getting your mammograms. And even though we see a lot of pink in the month of October, and it can seem annoying at times, it is good to get the word out to remind ladies to get their mammograms. And the earlier that we can catch a breast cancer, the easier it's treated. So in Ohio, just to bring it a little closer to home, over 11,000 women in Ohio will be diagnosed with breast cancer, and 1,400 will die from this disease this year. So it's still something that we need to be aware of. The most significant risk factors for breast cancer are age and gender. As women, women just are going to have a higher risk of developing breast cancer, and the older we get, the increased risk of developing breast cancer. So some risk factors we can control and some we can't control. You can't control your family history, or getting older, or being a woman. Also, if you start your periods early on, or have menopause late after age 55, that increases your risk. There's some inherited genes that increase the risk of developing breast cancer. And then there's also dense breast tissue, which we'll talk about here in a little bit. But things that we can do to help control our risk, to help lower the risk of developing breast cancer, things like maintaining a healthy weight, avoiding hormonal replacement therapy, not smoking, getting good exercise, and eating right. All these things do help cut down on our risk of developing breast cancer. So important breast cancer risk factors, like I said, dense breast tissue, genetic mutations like the BRCA gene can also increase your risk. Other things that we look at when we're trying to decide if a lady is high risk or not: family history, history of prior breast biopsies, even if they were benign. Weight goes into this calculation, and also if someone has a prior history of chest radiation, that would increase the risk. So mammography, as we know. It's an X-ray of the breast, and it has been shown to save lives, but a normal mammogram does not completely rule out an abnormality. So this is a slide that I like to use because mammograms are not comfortable, and they do get squished, but it's the best test we have right now. It uses low-dose X-rays, and with this, we can identify any abnormalities in the breast, either spiculations or masses or calcifications. And it's important to know that mammography can show changes in the breast for up to 2 years before you might be able to feel an abnormality, and that's why a mammogram is important. It's another picture with just the mammogram machine. I like this picture because the ladies are smiling like it's a nice, pleasant day at the spa, but it's not. It's mammograms hurt. There's no two ways about it. So the two most important mammographic indicators that we're looking for are masses and microcalcifications. On the left-hand side is a mass that you might see, and on the right-hand side are microcalcifications, which are little areas of calcium deposits that can be a sign of either an early cancer, or sometimes they're benign changes and we don't worry about them. This is an example of what we might see on mammogram. On the left-hand side, a malignant mass. Cancer would have a more irregular spiculated look to it, and on the right-hand side is a more benign appearing mass like a fibroadenoma or a cyst with nice smooth margins. Next slide. But mammogram does have its limitations, and ladies who have dense breast tissue, it may not show everything that's going on within the breast tissue. So this is a picture of a drawing of breast tissue with the milk ducts and the glands, and then there's some pink area around the ducts and the glands, which is the fibrous tissue. And if a lady has a large amount of fibrous tissue, then we consider that she has dense breasts, and this makes it tougher to see things on mammogram. This is the 4 different categories that we divide mammogram density into. On the far left is the fatty breast tissue, and then next is scattered fibroglandular densities within the breast. And the 2 on the right, the heterogeneously dense and the extremely dense, are what we consider the dense breast tissue. And those are the categories where we see an increased risk in developing breast cancer. And sometimes we recommend additional screening when we find ladies who have dense breast tissue on mammogram. So about half of the ladies in their 40s will have dense breast tissue. This decreases some as women get older. So when a woman gets into her 50s, about 40% will have dense breast tissue, and then ladies older than age 60, about 1/4 of the population of women will have dense breast tissue. But as you can see, the percentage of density, as it increases, then the relative risk of developing breast cancer also increases. If the density is less than 25%, the relative risk of breast cancer is only 1.79%, but that jumps up to 4.64% in ladies who have extremely dense breast tissue. So a law was passed in 2022 in the state of Ohio. It's the HB 371, and with this, Ohio became one of the few states in the nation that allows for additional screening modalities after mammogram. So what this law said is that the health insurance and Medicaid must provide screening coverage for screening mammograms, and also for any additional supplemental screenings like ultrasounds or MRIs for ladies who have dense breast tissue. It also ensures that 3D mammography or tomosynthesis is covered. Next slide. So with this, this really has changed how we manage ladies with dense breast tissue, and it has helped us find additional breast cancers with this additional screening. So this slide is a little busy, but on the top you have the old school 2D mammogram or two-dimensional mammogram, and then the 3D mammo is the tomosynthesis. And most of our machines, I think all of our machines actually now in Mercy are of the 3D tomosynthesis type. So we've made that switch, and that's a good thing for ladies that we now have this 3D mammography. But if you have dense breast tissue and you add an ultrasound, then that will increase the number of breast cancers that are found. And then that bottom line, mammography plus MRI, significantly increases the number of cancers that might be detected in a lady with dense breast tissue. So what do we do with ladies with dense breast tissue? And on the left-hand side, that category says if you're at high risk with or without dense breast tissue, then we recommend having a yearly breast MRI in addition to yearly mammogram. And we calculate risk if someone's high risk based on, well, in this practice, we use the Tyrer-Cuzick risk assessment model that factors in family history and weight and history of hormonal therapy and age and all sorts of things to spit out a number to tell us if patient's lifetime risk of developing breast cancer. And if the risk is 20% or higher lifetime risk, then we consider them high risk. And those ladies, we do like to get yearly MRIs in addition to mammograms. And we usually try to stagger the MRIs about 6 months after the mammogram so that we're getting some sort of breast imaging every 6 months. Now, in the center box here, if you have dense breast tissue and you're not high risk, then we still consider additional screening to look at the dense breast tissue, either with an MRI or possibly an ultrasound. And then finally, on the right-hand box, if you've had breast cancer, then we do recommend a yearly mammogram. And the radiology groups are now recommending MRI for dense breast tissue, or if you were diagnosed before age 50. So we're starting to see more recommendations for MRI on ladies who have had breast cancer. Not all the societies are agreeing on this recommendation, but I think it's going to change in the next few years. So that's it for dense breast tissue, and we'll take any questions or comments.
We had a question in the chat.
Okay.
Does having dense breasts increase your risk of developing a cancer or just make it tougher to detect if you do have a cancer?
Both. Yeah, it can definitely increase the risk of developing breast cancer because there's just more breast tissue in the area, and the more breast tissue compacted into a small area that is dense breast, then that's going to increase the risk. And then also it just makes it tougher to identify early breast cancers, which is why we like to get the additional screening.
Any other questions? Feel free to come up mute. Go ahead.
Marianne, I have a question. Dr. Sobolewski, if you, with breast cancer being diagnosed at younger ages these days, and I'm assuming how do you know if you have dense breast tissue prior to having a mammogram, especially if you're not allowed to have a mammogram until you're 40?
Yeah, well, that's a great question. Most young ladies, you know, under the age of 40, we do find that they do have breast cancer, or they have dense breast tissue. And we don't usually recommend getting mammograms in ladies routinely under the age of 40 because so many of those ladies do have dense breast tissue and we can't really get good information. Having said that, if a woman has a strong family history of developing breast cancer, or if she's tested, genetic tested positive for a BRCA gene or one of the other mutations that might increase her risk of developing breast cancer, then yes, we are going to start early imaging, usually with an MRI around age 25, and then at age 30, we would start getting the mammograms. But no, women, we just assume that all young women have dense breast tissue, because that's just kind of the way young breasts are.
Thank you.
Yeah.
Anybody else? Why get a mammogram plus MRI? Oops, let me get into the chat.
Yeah. So we need both modalities. We've talked about how MRI is so great at detecting things that mammography cannot see. But mammogram is really good for one thing that MRIs are not good at, and that's for looking for those microcalcifications. The microcalcifications can show up really well on mammogram, especially, or even in ladies with dense breast tissue, and they don't show up nearly as well on MRI. So that's why we need to get both imaging modalities of the mammogram and the MRI. Good question.
Another question: how much does BMI or being overweight increase your risk?
So it increases the risk, relative risk, about 2. So it definitely increases the risk, and the reason for that is the fatty tissue that we have in our bodies, we get estrogen secretion with that. And a lot of tumors that we're finding with breast cancer are respond or grow because of estrogen in the body. They're hormone fed. So by having extra weight on board, that increases the amount of estrogen that's running around in the body and affecting the breast tissue, and that can increase the risk of developing breast cancer.
To piggyback on that question, what if does BMI or being overweight, if you have a history of those things, but you have since lost weight, does that make a difference?
Oh yeah. Yeah,
Okay.
anything that you can do to cut down on the body weight or affect any of those other modifiable risk factors, then that will lower your risk. So you know, the new thing now is the GLP-1s and you know, weight loss medications that are out there. And it's too early to tell, but there's some early studies which are showing a decreased risk in ladies who have gone, a decreased risk of breast cancer and other cancers on ladies who have undergone or started those treatments. So stay tuned with that.
That's good news.
Yeah.
Any other questions? Okay, well, thank you so much for attending. I will send out this recording to everyone who registered. And if you know of anybody else that would like to see this presentation, we'll have it on our YouTube site. Thanks again. Have a great rest of your day.
Thank you. Thanks so much for coming, guys. Appreciate it.